We knew going in that we had some limited resources available, people here in Chicago who could speak Creole, and we were blessed with having two Haitian native nurses who spoke Creole fluently, but worked in neonatal intensive care and surgical intensive care in hospitals here in Chicago. And they were graciously willing to come along with us, and their contribution was absolutely essential. There are people in these areas who can speak some English, and very often will try and help you translate. Interestingly enough, the orphans in the orphanage who were still there and still participating in care when we got there had all been learning English in their classes, and so they had some ability to speak both English and French and Creole. But our nurses are trained medical professionals who know how to do things and say things in Creole, but also know a great deal about medicine and surgery and illness and disease, and who have a complete vocabulary for all those things. And so the presence of the two Haitian nurses in the triage tent was absolutely essential. It essentially cut through all of the translation difficulties and made it possible for Dr. Hayden to go right to the quick and deal with people immediately, rather than to have to go through a fumbling sort of translation. These women were simply outstanding. They worked incredibly long hours. They were incredibly patient, and they were extraordinarily sophisticated in the way they dealt with the Haitian people and with the medical personnel. And I think clearly they were the greatest contribution that we were able to make to the medical care of people in the camp was the presence of our nurses. And their skill as nurses and as native Creole speakers, without them, it's impossible to imagine what it would have been like.
What have you done in here?
We alphabetized the shelves with what we use the most.
Who are those people over there?
Those are the pharmacy technicians.
Excellent. Where do we get pharmacy technicians?
Haiti.
We're used to having a well-stocked, well-organized pharmacy where we can get what we need simply by writing a prescription for it or giving an order over the telephone. There's a big machinery in the hospital that makes all that happen. None of that machinery was present in the Love a Child field hospital when we got there. There was a room that was designated the pharmacy, that is, it had the word pharmacy above the door, but it was basically a room filled with cardboard boxes with drugs in every possible description and order, and no organization whatsoever. After we'd been there for a while, we got one of our clinical pharmacists from the University of Chicago, a person who is multilingual, speaks fluent French, and is very experienced in the pharmacy, who came down and rebuilt from scratch, or built up from scratch, a pharmacy that is comparable to any that you'd see in a modern hospital. She came in, went through all the materials, separated them all, organized them all, and then with the help of a Haitian carpenter and his hand tools, constructed a real pharmacy with shelves and tables and countertops that looks quite like any other hospital pharmacy. And by the time we left, we had a pharmacy that could prepare intravenous injections and intravenous drips to order, and prepare and deliver drugs in specific amounts and specific types. And perhaps most importantly, pharmaceutical expertise, since we now had a clinical pharmacist who could look at the various kinds of things that people were requesting and see the conflicts and contradictions and contraindications there. People ordering medicines and not getting the right name, or having trouble with the dosage, or ordering the same medicine in two different forms. And that probably was happening a great deal in the camp prior to the appearance of our pharmacist. But once she was there and beginning to look at all these things, we were able to get a coherent and I think safe modern pharmacy operating. And the ability to give people medicines is a really critical part of running any field hospital. To get the right medicine to the right patient at the right time is really essential here, especially because so many of the people are dealing with infected wounds and other kinds of problems, and many of the people are malnourished and therefore having trouble healing their wounds. So the pharmacy was an enormous improvement, and I think is one of the lasting legacies of our participation there. It's certainly one of the things of which we're the most proud. I think it's probably too early to answer the question, how has it changed me? I'm still reverberating from the experience, and I think that will continue for quite a long time. You know, there's the experience of the quake, and then there are the aftershocks, and I'm still having lots of aftershocks, personal aftershocks. I think that our contributions to Haiti are important and significant, but they're small compared to the scale of the disaster and the needs there. And that's made clear by the condition of the Haitian people and the condition of their cities and the way they are forced to live. Many of the problems in Haiti predated the earthquake, and so this is a place that is extremely poor and has very little health care and has a lot of trouble getting clean water and adequate food supplies to its population. So the problems we see are endemic. For myself, I think my notion of Haiti before I went there was a romantic one that was derived from film and stories, and not very well calibrated. And I didn't know anything about the Haitian people or what they were like. I found deeply religious people. Sunday is a day of rest and religious services there where everybody puts on the finest clothing that they have. And people in the hospital can't put on white shirts and ties, and the girls were in white dresses. Now, how people manage to save a white shirt and a tie or a white dress in the midst of all this earthquake and bring it with them to this faraway field hospital is beyond me. But you'd see them on Sunday for the religious services. And the Haitian people have a deep and abiding faith that is very moving and very impressive. They're extremely patient people. They are exceptionally polite. You can say good morning to someone who has an amputated left arm, and they will say immediately back good morning. And if you ask them how they're doing, they will say, I'm doing well, thank you. That kind of resilience is quite remarkable, and I'm not sure it's found anywhere else in our hemisphere. Haiti needs continued supply of all sorts of support and all kinds of resources, not just medical ones, although medical resources are very important for them. But it needs food and water and reconstruction aid. It needs education for its population. It needs a social system that's capable of taking care of the now many homeless, elderly, and orphan children. All those things are needed, and there's no way our small medical group could ever hope to provide those needs, but there is a crying need for us to encourage people to continue to support the Haitians now and for the years to come. There'll be other disasters that will push this off of the front page, but the continued disaster that is Haiti will still be a disaster a year from now, and the people there need continued support and all the help that they can possibly get. But I think that all of these things could be managed, and all of them can be addressed if people have the will and the constancy of purpose that's needed to actually bring all of the support that's possible to Haiti. It is possible to do great things there, and the Haitian people are people who are certainly worth that kind of effort. They are remarkably resilient and incredibly stoic about what they've experienced, and I have no doubt that they will continue to survive and prevail.